Right, let's get an update now on the situation at South Africa's healthcare facilities, at least in 5 provinces that are affected by this strike. Let's begin with Nobuhle Modise, and she is in KZN at Harry Gwala Regional Hospital, to be exact. That's in Pietermaritzburg. Nobuhle, good morning to you. Paint the situation for us where you are.
Things have calmed down, Xoli, and it's completely different from what we saw this morning, where there were snaking queues of people waiting to come in. Those included workers who are not affiliated with Nehawu and patients who were trying to get into the hospital. But now it seems as though people have gone home, and the people that are remaining here are those Nehawu striking workers. But like I said when I spoke to you earlier, some of the patients that were being discharged, that were inside, that were coming out of the facility, were speaking about the fact that there wasn't any help that they were receiving. I did speak to you earlier and say that there was a woman who had brought her child in last night who had broken his leg, and he managed to get a cast put on, and after that there was no medication available and he was discharged without receiving any medication. I also spoke to another woman who came in. She's pregnant, and she was speaking about the fact that her 2-year-old as well was also sick, and they were coming to the hospital to seek for some help. Let's take a listen to what those 2 women had to say.
Now I'm using Zwelak's
manje izolo sifika izolo ebusuku yalithola usizo inkinga ibe manje ekseni ngesikhathi esefuna athola amaphilisi kwasho ukuthi manje abekho odokotela bamaphilisi
bengizele clinic ngilethe esibhedlela ngilethe umntwana so enda phezulu usizo cause onesi abaphelele ama pharmacy avaliwe so siyabuya manje semakhaya nengane ayikho right namanje ikho right.
So as you can hear, Xoli, a lot of those people that are coming outside, coming from the hospital, are just talking about the fact that this particular strike is affecting them badly because they're not receiving the services that they came here for. As I'm speaking to you now, I'm going to ask my colleague Lungelo to pan so you can see some of the COSATU members that are coming here and some of the Nehawu members who are coming to join these striking workers that are here. But of course, there's no services that are being given to any of the patients who are coming here to the hospital today. And these are the scenes that we've been seeing throughout the past 3 days, where they're keeping away patients, they're keeping away workers. And these are the scenes that we will continue to see until they say those demands that they're asking for are met. Back to you, Xoli.
Nobuhle Modise, live for us in Pietermaritzburg at the Harry Gwala health facility there. All right, let's continue the coverage and take you to the northwest now, and the facilities in Klerksdorp, Potchefstroom, Vryburg also affected. Our reporter Refiloe Seboko is at the Tshepong Hospital in Klerksdorp. She joins us now. Refiloe, good morning to you. What is going on where you are?
Good morning, Xoli. Well, relatively calm. We saw just a little bit earlier, just before you came, some of the Nehawu members had came here to protest just outside the Tshepong Hospital, but also there's been an engagement with the Nehawu. I'm going to welcome Muder Ngwenya to come and just explain to us some of your demands, Muder, and also that engagement that you had with your members earlier today.
No, our demand is very clear. We reject a 3% because it's not in line with CPIX. We now want a 2,500 for housing allowance because it's been years we've been getting a 1,200 for housing allowance. So as the working class, we cannot afford to buy a house with that little money. So we're now saying that because of the employer today is now coming on board, it shows very clearly that our bargaining rights will be respected. So as to what is going to happen with the meeting between the employer and the union today, I don't want to preempt. We will wait for the leadership to communicate with us. Yes.
And as much as you don't want to preempt, and then this strike has inconvenienced the services. We know that here in Tshepong Hospital. So though today's services seems to be relatively calm, people are being allowed to get in and out. But some of the patients that we were talking about to say this is a serious inconvenience to them. What's your response as Nehawu?
No. As Nehawu, we have agreement with the management with regard to the issue of essential agreement. So in that essential agreement, we have agreed that how many staff will work there. So patients we've been given an access to access the facility, and ambulance were also given an access to enter the facility. We don't have any impact with regard to the issue of patients. Patients were getting treatments. Those who are in the wards for treatment, there are doctors there. They were getting help.
Yes. I was saying, as much as you don't want to preempt, what is it that you are hoping from that meeting that you will be having later today?
No, we hope that the employer will come on board. The employer will ensure that she implements the demand that we are expecting from employer's side, because there are demands there. The union will table the demands. So we hopefully that the employer will implement those demands. That is our hope as the workers.
Thank you so much for your time. Muder Ngwenya from Nehawu here in the Northwest Province. What we also understand is that the Department of Health in the Northwest Province, MEC Madoda Sambata, as we were trying to engage with him, or rather arrange so that we have the latest from him on how the department is handling this situation. We understand that as much as some services were inconvenienced, we also understand that he is making his way here to Tshepong Hospital to come and just assess. What we also indicated was that Tshepong Hospital, as much as there are some services that are inconvenienced in Klerksdorp here in Tshepong Hospital, in Joe Morolong in Vryburg, together with a hospital in Potchefstroom, they said that they have noted that Tshepong Hospital is what they said it's a hot spot in terms of these protests by the Nehawu members. We'll wait to hear from the MEC of Health in the Northwest Province, Madoda Sambata, and give you an update as soon as he gets here.
Seboko, thank you very much for that update live for us in the Northwest there.